Hey everyone, welcome to Science Sparkles. It's ADHD Awareness Month 2024, and today we're diving into everything you need to know about ADHD. Whether you're newly diagnosed, supporting someone with ADHD, or just curious to learn more, this video will break down the essentials. So let's get started. First, what exactly is ADHD? ADHD stands for Attention Deficit or Hyperactivity Disorder, and it's a neurodevelopmental disorder that affects both children and adults. There are three main presentations of ADHD: inattentive, hyperactive impulsive, and combined. Each type has its own set of symptoms and challenges, and understanding these can help in managing the condition effectively. The inattentive type, often called ADD, is characterized by difficulty sustaining attention, forgetfulness, and disorganization. People with this type might find it hard to follow through on tasks, often losing things or making careless mistakes. The hyperactive impulsive type presents with excessive energy, fidgeting, and difficulty controlling impulses. This can manifest as an inability to sit still, constant movement, or acting without thinking. The combined type includes symptoms from both the inattentive and hyperactive impulsive types, making it even more complex to manage. ADHD isn't just about being hyperactive or having trouble paying attention. It's a much more complex condition that impacts behavior, emotions, and daily functioning. ADHD is quite common. According to the CDC, about 5 to 10% of children and 2.5 to 4% of adults are diagnosed with ADHD globally. What many people don't realize is that ADHD is a lifelong condition. It's not something kids grow out of. In fact, symptoms often persist into adulthood, although they may look different. So, what are the signs? In children, you might see difficulty focusing, trouble following instructions, impulsiveness, or excessive fidgeting. In adults, ADHD might show up as poor time management, forgetfulness, difficulty completing tasks, or even relationship challenges. Remember, ADHD can look different in each person, and the symptoms can change over time. If you or someone you know is experiencing these challenges, it might be worth seeking an evaluation. ADHD is usually diagnosed through a combination of behavioral assessments, interviews, and clinical observations. For children, parents and teachers often play a big role in identifying symptoms. However, many adults are being diagnosed later in life, sometimes after recognizing their own symptoms in their children. It's never too late to seek a diagnosis. Once diagnosed, there are several ways to manage ADHD. Medication is one option, usually stimulants like Adderall or Ritalin, or non-stimulants like Strattera. Behavioral therapy, such as cognitive behavioral therapy or CBT, helps with coping strategies and managing everyday challenges. Lifestyle changes like exercise, mindfulness, and using organizational tools can also make a big difference. It's important to work with a healthcare provider to find what treatment combination works best for you or your loved ones. ADHD isn't a one-size-fits-all condition. Living with ADHD can be challenging, especially in school, work, and relationships. In school, children may struggle to focus, follow instructions, or stay organized, which can affect their academic performance. At work, adults with ADHD may find it difficult to meet deadlines, manage projects, or stay organized. And in relationships, misunderstandings and frustration can arise if symptoms like forgetfulness or impulsivity are not understood. But it's important to remember that ADHD doesn't have to be a barrier to success. With the right support, people with ADHD can thrive. 2024 has been an exciting year for ADHD research. We now know that ADHD is part of the neurodiversity spectrum, which means that brains function differently, and that's okay. Advances in brain imaging and AI technology have given us new tools to understand how ADHD affects the brain. On top of that, there are now apps and tech tools designed specifically to help manage ADHD symptoms, like task management apps and focus-enhancing tools. If you're supporting someone with ADHD, whether it's a child, partner, or friend, patience and understanding are key. Help them create routines, break tasks into smaller steps, and offer encouragement. For those in the workplace, simple accommodations like flexible scheduling or clear communication can make a world of difference. Many people with ADHD also experience other conditions like anxiety, depression, or learning disabilities. These comorbidities can make treatment more complex, but recognizing them is an important step toward effective management. Finally, let's not forget about the strengths that often come with ADHD: creativity, problem-solving, and out-of-the-box thinking. Some of the world's most successful entrepreneurs, artists, and innovators have ADHD, proving that with the right support, anything is possible. One of the most common myths about ADHD is that it only affects children, but this is far from the truth. While ADHD is frequently diagnosed in childhood, it's actually a lifelong condition that can persist into adulthood. Many adults live with undiagnosed ADHD, facing challenges in work, relationships, and daily responsibilities, often without realizing that ADHD is the underlying cause. Recognizing that ADHD affects people of all ages is essential for understanding and providing the support they need. Another harmful misconception is that ADHD is caused by bad parenting or a lack of discipline, which unfairly places blame on parents and caregivers. In reality, ADHD is a neurobiological disorder, meaning it's rooted in brain differences. Research has shown that individuals with ADHD have structural and functional differences in their brains, which affect areas like attention, impulse control, and executive functioning. While environmental factors like a high-stress environment can worsen symptoms, they do not cause ADHD. Understanding this is key to providing the right support and interventions, and to reducing the stigma often placed on parents or individuals with ADHD. And here's another myth we need to address. Some believe that medication is the only solution for ADHD. While medication can be incredibly effective for some, it's not a one-size-fits-all answer. Each individual with ADHD is unique, and their treatment plan should be tailored to their specific needs. Many people benefit from a combination of treatments, including behavioral therapy, lifestyle changes, and support from loved ones. Things like exercise, mindfulness, and journaling can be powerful tools in managing symptoms. A comprehensive approach, including therapy, lifestyle changes, and a strong support system, can be key to effectively managing ADHD. Organizational tools like planners and reminders, as well as breaking tasks into manageable steps, can make daily responsibilities less overwhelming. Support groups can also offer a safe space where individuals with ADHD can share their experiences and learn from others. Being part of a community that understands your challenges can be incredibly validating. Practicing mindfulness and engaging in creative outlets, like painting or playing music, can also help channel focus and energy in positive ways. These activities not only reduce stress but can provide a sense of accomplishment. Another great resource is working with an ADHD coach or mentor. Coaches can provide support with setting goals, developing strategies, and offering accountability. For many, having someone who understands ADHD can make all the difference in navigating challenges. Educating yourself about ADHD is also crucial. There are countless books, articles, and even workshops that offer practical advice and research insights. This knowledge empowers individuals to take control of their health and well-being. Journaling can be a powerful tool for self-reflection. For those with ADHD, it's a way to track progress, identify patterns, and set goals. Writing about daily experiences can provide clarity and help with managing challenges. Getting involved in community events or advocacy efforts can also raise awareness and reduce stigma. Sharing personal stories helps others better understand ADHD and encourages broader acceptance. Finally, let's not forget the importance of celebrating successes. Recognizing both personal achievements and community efforts helps maintain motivation and promotes a positive outlook. By working together, we can create a more inclusive and supportive world for everyone living with ADHD. So, as we celebrate ADHD Awareness Month, let's continue spreading awareness, understanding, and support for those with ADHD. If you found this video helpful, be sure to hit that like button, subscribe for more content, and share this video to help raise awareness. Together, we can make a difference.